What's up, mi gente? It's Anthony Rosa, the community finance coach, aka Mr. Remedy, and today we have a very interesting conversation on our segment for Money Monday. Today we're talking about surprised billing, surprised collections, and of course, I have a special guest, my friend Claudia from NBW Consultant. I'm super excited, Claudia, to have you on and having this conversation. So let's just jump right into it. Claudia, thank you for being on. Please feel free to come off mute, introduce yourself, and let's have a really interesting conversation.
Hi, Anthony. How are you? Great to see you. Let's
Great
do
to see
this.
you, for sure.
Okay.
So why don't you tell everybody what you do?
Okay, so we are a billing company. We've been in business for about 16 years and we do medical billing collections for doctor's office, surgical centers, anesthesia, primary care physician, pharmacy, you name it. So our legacy stands on the trust that the providers have put on us. And because we try to be as honest as we can to our providers and to our patients.
Now I can
So,
imagine, right? This is a common battle with the consumer and the insurance and the physician office, and you're in the middle of it.
yes, sir. We are in the middle of it. Um, we call it surprise billing because a lot of our communities, especially the Spanish communities, it's a taboo. Oh no, I have insurance. I'm covered. No, the insurance companies have changed tremendously, and now having insurance is not just I'm covered. I have insurance. There is a lot of things that have been left out. For instance, if the doctor sees you in their office and that particular doctor doesn't participate in your insurance,
Out of network.
out of network, you get hit with a bill and you're like, well, this is a surprise for me.
Right,
Surprise billing, surprise collection.
right,
So there you have it. That's the biggest number one right now. Or even when you go to the emergency room, oh no, but it was an emergency. Okay, that changes is everything. But some emergency rooms don't take your finger cut or your diabetic wound as an emergency because they're pre-existing conditions that they've been with you in the past. So
right,
they automatically say it's not covered. So
right.
our Latinos are, and everybody in general, oh no, but I have insurance. Why is it that it's not covered?
Right.
There you
We're
have it.
talking about having the right insurance. And for those that are watching, I challenge you, review your insurance. Don't wait until it's too late. Claudia, I really appreciate having you come on. And we're just starting this conversation. But surprise billing, surprise collections. Nobody wants a surprise. And
Not the collection surprise,
not the
not the
collection
billing
surprise.
surprise. Yes.
I was reading about this and it said in 2020 nearly 4 million adults ages 65 and older reported having 53.8 billion dollars in medical bills that they were unable to pay. Imagine that.
That is absolutely right. And then, oh, the doctor is not the greatest. He sent me a bill. Oh, but why didn't tell me? Oh, but yes, there are some providers that they just simply do not know and they don't understand. But most part of the providers will say, hey, listen, we don't participate into your insurance. But do you really need care right now? But that's in an office setting. What happened when you are getting an x-ray? What happened when you're in the hospital because you broke your toe or your finger or your arm? And then that goes back again to the surprise billing.
Right.
Sometimes it's impossible almost not to, but we need to be conscious as and careful about where we go, how we go, and learn a little bit more about your insurance. That's very important.
I agree, right? Because I think, why do people have billing problems? And I think that it's because they don't understand the basics of their insurance.
Right. And they automatically assume I have insurance. I can go and be taken care of. It's not
Right.
like that anymore. It's not just about having insurance. There's a lot of doctors' offices that they don't take Medicare.
Right.
Who would have thought that nobody in America is not going to take Medicare? But guess
Right.
what? A lot of people is not taking Medicare. A lot of doctors, a lot of primary care physician, but they don't take it. They don't participate with Medicare, but they take it if it's an emergency. But then
Of
here we
course.
go again, surprise billing.
Surprise billing. Yeah. And look, it's complicated, right? We get it.
Super
It's very
complicated.
complicated. And people think that, like you said, they have insurance. But to be fair, insurance changes year by year. But
Yes.
if we're not proactive about what our insurance is covering and who's in network, then that's when we kind of pay the price.
Yes. And as a providers, we get blamed a lot. And listen, some doctors' office, they forget to ask a lot of the patient, hi, Mrs. Fulanita. Today is January 1st of 2024. Did your insurance change? Do you have a new insurance card? And then
Mm,
we keep billing the patient with the insurance from the last year. And then the patient is like, but why are they billing me? I have new insurance. Oh, okay, all right. It's six
there you go.
months into, billing the patient, but we don't know. So it's
Right.
important that the doctor's office also get educated and, we're honest with the patient and say, hey, listen, in 2023, you had this insurance. Now you had this insurance. Your benefits is changed. Now you have a $2,000 deductible. Now you have a $30 copay instead of a 15. So that's why it's important that the doctor's office is always reminding the patient, hi, good morning. Thank you for coming. Can I have your insurance card? And make sure that we take the picture in every visit.
Right.
There's companies that switch insurance in the middle of the year. There's companies that do it at the very beginning of the year. Or there's people that changes jobs in the middle of the year. Almost, you know. So that is important that the doctor's office also take a full responsibility in educating their members. Every time a patient comes to the office, we need to ask for the insurance.
Right. And we're talking about surprise billing.
Yes.
And I just want to make, as a finance coach, it's very important that if you were to call and you set up some type of payment arrangement, guess what? It might not go to collections. So if you're receiving bills, because sometimes some of the members that I deal with, they don't want to deal with it, right? So what are some instances, Claudia, where you saw where on the individual side, now we're talking about the individual side, we haven't even gone to the practice side, right? On the
Right.
individual side, how can people protect themselves a little bit more?
Okay, so let's just say that you didn't feel good at all that day, and your illness didn't took you to the emergency room because you're like, no, 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 I just have a headache and I have a fever. I'm gonna go to my primary care physician, and let's just say that you have a new Blue Cross Blue Shield. It's not a PPO anymore; it's an HMO, and you don't have out of network benefits. And then your provider is, I have fever, and they take care of you, and they forget to make a copy of your card, and then 30 days later, you get a bill. Important communication, understanding your benefit, understanding the doctor's office. Hey, listen, I came in, I was sick. I didn't pay my copay. Now my copay is $55. But then the insurance company is only paying, 120, but I already paid this much.
Right.
I already paid this much. Can we work on things so that way my credit doesn't go bad?
Of course.
Of course, no problem. The insurance company was only going to pay us $85 and you already pay $55.
Right.
Listen, give us $5 a month, or if you want to pay the remaining balance, that's fine. But remember, we need those members to continue to support our practice. But also, there is a new law that says that the providers that they don't bill their members, they can also get in trouble for their
Right.
copays and their coinsurance.
It's interesting that you talk about that, right? Because again, we're talking about surprise billing, surprise collections, and 60 to 65% of denied claims I'm finding are not resubmitted.
They're not resubmitted. They're not resubmitted. And that falls into both. 50% goes to the provider and 50% goes to the patient because the
Right.
patients get their bills. But the provider also, there's a lot of billing companies that are very automated. They don't call.
Mm,
A lot of our collections departments nowadays is being run someplace in Africa or in India,
overseas, yeah.
where overseas that are, you know, for instance, our community is very Hispanic. So if we get somebody that doesn't speak Spanish, my grandmother or your mother is gonna hang up
Right.
and say, "Oh, yo no sé.
Right.
I don't know. I have insurance. My doctor took my insurance that day, or he's been taking care of me for years."
Right.
No, it's important as the member and as the provider. It works both ways.
It's true.
They're equally at fault when it
And you
comes
can
to
save a
not being
lot
aware.
of money, right? By just listening to this video and going back to it, it's like, okay, let me review who's in network. Okay, do I have a bill within the last year that I'm getting charged on that I should resubmit that maybe my insurance can cover? Maybe
Exactly.
I should modify my deduction or my copays so I can review and maybe change the insurance and get another higher level so that I don't have to pay such high amounts and be just secluded to a smaller network of doctors. Very, very important stuff.
Very important stuff. Not only that, but remember, for the longest time, a lot of people were being billed, and it was because there's one number that changes in their insurance card, and the 2023 ID number was saying no, the member is not covered. So now you're sending a bill to the patient when you can simply say, "Hey, I have new insurance card. I just noticed that you're billing my old insurance card," and that could change the course of everything. And also keep in mind that the insurance company only allows the doctors 30, 60, 90 days to make those corrections. If
Yeah,
we don't make it in that 60, 90 days, sometimes, very few times, 120 days from the day that we had the services, then they say, "No, you're too late. We send you a letter 6 months ago, 3 months ago, 2 months ago." And if the time is expired, that's it. They
right,
make us responsible, us the patient or the doctor. The doctor didn't resubmit the claim, but my patient did send me the new insurance card. So that's the doctor's fault. That's what I'm saying. It's
right,
equally patient and doctors. They
right,
have to be aware of what's happening.
right. So for those that are watching, when was the last time you got your insurance reviewed? Right. Um, I think that
Very important.
very important. Get an insurance review. Now, we're not insurance professionals here. We're not claiming or giving any recommendations. This is just strictly educational on the Money Monday segment, right?
Yes,
So call both your insurance company and the billing department of the doctor's office just to make sure that you understand the claim denial or what's being covered in the claim, and just have a conversation. Don't wait until it's too late.
absolutely. I agree with you 100%. The insurance companies, 90% out of the time, they have the wrong insurance. They have the wrong ID number. And that's a huge one,
Right,
because it's important to call them and say, "Hey, do you have my new insurance card? I'm looking at it right now. I have a new ID number and whatnot."
right.
So yes, it's very important as a members and as a doctor's office that we have a lot of communication with our patients.
Right. So I don't want to talk too much about this, right? But Medicaid versus Medicare. I'm
Yes,
I'm finding a lot of young adults that do not have insurance. Okay. So I'm finding these young adults that don't have insurance, that don't have high income, and they don't apply for anything.
very important comment. It's very notorious, and even back then when President Obama indicated that everybody that is an American citizen or that has any legal status in this country has to have insurance. Why? Because we have the plans that there is a lot of coverages for a lot of low income individuals, and there is a lot of doctors that are in network. So What Anthony brought to the table is very important. If you're not over 60 to 62 years old, obviously Medicare is not going to kick in unless you have a changing life condition that has left you with no more work, and that
Right.
changes completely.
Right.
But for the most part of individuals in America, everybody has the right to have insurance. I had people that they only pay about $20 a month in insurance.
Mm.
And there is a lot of providers that they will take that insurance because those providers are supported by the state locals and by the federal programs. So we have it. Please make sure that you have insurance,
Right.
especially young adults or especially anybody that has any underlying condition. Now they're able to have insurance for even $5 a month.
Yeah, absolutely. It's so economic.
Yes.
And just because we're on the topic, can we talk a little bit because how many years have you been in the industry now?
I've been in the industry for about 28 years.
28 years.
Yes.
And I'm sure that you've heard some amazing stories where insurance was able to cover everything, and I'm sure you heard some stories where people were kind of less fortunate, didn't have enough qualifications, it wasn't covered. And can you talk about charity care? I have up here, for those
Yes.
that don't have insurance, they don't qualify, and they're just dealing with things. They're dealing with ailments, they're dealing with pains, and they just don't know. Some hospitals offer charity care, and not all of them offer, right? So if you're going to go to an emergency room and get service done, make sure that they offer charity care. So
Yes.
what can you say about charity care?
That's a very good question too. Um, Charity care, about 95% of the hospitals in the United States offer charity care, meaning the state and the federal programs will fund those hospitals to
Mm,
pay for those bills. Sometimes there is no funds, but then the chairmans in the hospital, they push all of those people to fund the hospital to be able to support that area. Meaning,
mm,
okay, your bill is $500 for anesthesia, hypothetically,
right,
and the anesthesiologist knows that you only have the care from charity care in the hospital. So and instead of that bill being $500, hypothetically, it could be
right,
less, it could be more. So they say, okay, all right, um, because the hospital funding and because of the hospital charity care program, we're only going to charge you $125 for anesthesia. Hypothetically, the
mm,
numbers could change based on the hospital protocols and
right.
whatnot. So the patient starts paying as he go into that. And believe it or not, a lot of Hispanic people, a lot of African American, a lot of people goes through charity care.
Yeah, they do.
It's very fundamental
It's
that
there
we
for a
remember,
reason.
yes, there is there for a reason. And it's being utilized a lot. It's
Right,
being utilized a lot. So it's important that we know that if we pay taxes in this country, a lot of our taxes go to all of those charity cares because they're local or they're federal funded. So it's
right,
important to do that. Yes, it does exist. In some hospitals, they cover more the hospital and the attending physician. Sometimes the anesthesia, they don't really cover it that much, but in some instances they do. So if you happen to have an emergency and you don't have insurance and you have to go through charity care, it's important that as soon as you get a little bit better, you call the hospital and you tell them, listen, I don't have insurance. I have very little income and whatnot. And they will work with you 100%. Sometimes they even have different clinics that are run in the hospital to prevent emergencies,
mm,
like the dentist, like the eye doctors. And those are very important. A lot of people forget that our teeth, our eyes are another piece of the fundamental body. So
right.
it's important to remember. Go to your local hospital. Ask them if you don't have insurance. Do you guys have one of the clinics? Do you guys have clinics in the hospital that can help me with charity care? And instead of paying $400 for an office visit for an specialist, you're going to end up paying $55 or
It's
$25
a big
based
difference.
on your.
That's a big
It's a
deal.
huge difference.
That's a big deal.
Absolutely. It's
And so
absolutely.
we spend a lot of time protecting individuals, giving them remedies on how to prevent, um, really something that could be life changing, right? It's like
Yes.
you don't have, you know the money to pay for an emergency, let alone you don't have the insurance to cover. So what do you do? And sometimes people be stuck and they'll just deal with it. And I don't want anybody that's watching this to ever feel that way.
No. In this country, a lot of facilities will take care of everybody because if you go through the emergency room, you have to take care of the patient. But before it gets to that, I understand that there is an emergencies, but it's important that we understand our local hospitals and that we also support them. So that way, when that time comes, we know how to handle facilities and the hospitals and the billing. And once again, no surprise billing.
Right. And so can we take a moment and shed some light for physicians and doctors that may be watching, and for those that may be really great at what they do, but they don't really have the business side on 100%. So what do you recommend? How do you help physicians or doctors collect better?
So it's very important that we communicate with our providers, and our providers also sometimes we let ourselves down as providers because, oh no, the billing company will handle it. No, it has to be communication in between the billing companies and the providers, so that way they can understand the challenges that are happening and their front desk can understand what's happening. So it has to be a direct communication in between front desk, billing department, or billing companies that they're outside. So the physician also has to feel responsible, not just, oh, well, the patient didn't want to give me. No, we have to be kind. We have to be informative to everybody. A billing company is only as good as it get because of the front department is educated. The front department is the person that is going to be right there for the provider to be able to communicate to the patients and to the provider and the billing company. So yes, communication is the key for a lot of these things.
Where do you see, Claudia, are some downfalls or shortcomings that offices do, maybe from just not um, working with you with their medical billing, and they're not training their staff to catch?
That's an amazing question because I run into this all the time. Oh well, my biller has been billing Mr. Johnson for the last 3 months for an insurance that they don't have. Well, as soon as we hear that it's the first denial because the patient doesn't have the right insurance, so we go directly to the front department and we're like, hey, maybe we need to regroup, we need to educate, we need to read. Boom. Not all of the problems are going to be solved that way, but 99% out of it is communication. Communication with the patient. Billing company has to be very direct. I have a rule. Anybody that is my doctor client, I have to meet with them once a month and go over the good, the bad, and the ugly. And if we need to train, we'll retrain. If we need to figure out what's going on in the front, we'll figure out what's going on in the front. If we need to figure out what's going on with the patient, we go back. I'm very hands-on on my billing company, and I like to see what's happening, especially with all of my clients. And
Right.
if we need to educate, we educate. And if we need to call the patients, we call the patients. But we need to educate most than likely, and communication has to be open.
And so, who do you work well with? Because I know that in the insurance world, things have changed a little bit. So, family practice. Can you run a list of some of the billings that you help?
Okay. We have primary care physicians. Primary care physician, I would say, is probably one of the greatest one because you're constantly seeing your patients, whether they're young adults or that are older people or in the middle. They have to come and see the doctor at least once or twice every 2 months or once a year or whatnot. But primary care physicians are great. They're always in charge of everything that happens to the patient. um, Reimbursement is not as great as it used to be for the primary care physicians, but
Mm.
those are the core. of the whole medical system. Primary
Right.
care physician needs to have relationship with an orthopedic, with a gynecologist, with the neurologist, with everybody, so that way they can have trust and they can recommend the patient. The patient needs an EMG. The patient needs a head X-ray. The patient was running in the football field and they twisted their ankle.
Right.
So those are the things that make great relationships. But at the end, it all boils down. We have to have communication and
And it's so
education.
confusing, right? It's like, I have an ear, nose, and throat issue. I have to go to a specialist, so I'm always constantly getting referred. Then I got to go to an MRI session here, and then I got to get an x-ray there. And, and then I got to make sure that it's all in network because
Exactly.
at the end of the day, I don't want a surprise bill.
Billing. Exactly. And that's why primary care physicians are the core of what's happening in your health. They have to keep up with the new insurance that you have and say, hey, Anthony cannot go to 2 blocks up where he used to go get his blood work because now he has new insurance. We have to send him to 3 blocks up because that's where his new insurance indicates that he has to go for.
Right, right.
Exactly.
Wow,
So
this was an amazing conversation. Before I let you go, I want to ask, before we get into our final thoughts segment, what is one story in particular where you helped um, increase the profitability of the office by helping the doctor attain new business, just by billing differently?
not necessarily billing differently, but the fact that no one was showing the doctor, hey, we don't use ICD 9s anymore. We use ICD 10. That's the global weight of billing. So our billing was being rejected all the time. And I'm like, wait a minute. I see that your bills are not even processed. Your bills are being rejected because you're not using the right
Right.
system to do ICD 10s. So anyway, revenue when from being very little to being a lot. In fact, that first year that we did with that provider, and we started perhaps around May, we ended up with 1.5 million into the facility just by start doing the diagnosis under ICD-10, not ICD-9. So, and that's primarily in primary care physicians.
Well, I really appreciate you even just sharing that code. You didn't have to. You can leave the cliffhanger there. Say, hey, doctors, if you're having issues with billing, call me. But the people that we bring here, the hosts and the guests, on the Money Monday segment at Fresh Start, we have quality individuals. We want to inspire, connect, and educate you on different topics, a variety of topics. And today we talked about surprise billing, surprise collection. So if you missed the first half of our conversation, I highly recommend you go back on the replay. Claudia, as we're rounding third baits on the final thoughts of this show, talking about surprise billing, surprise collections, what are some of your final thoughts to encourage those that are watching?
Trust, educate, and constantly remind your employees and physicians that we have to educate our staff. Two thoughts: authorization versus predetermination.
Mm.
And I leave you hanging in there.
Two thoughts. Oh, she left us
Yes.
with a little cliffhanger there. I loved it. Thank you so much. Thank you. Now, I look. We can talk about this for a long time because there are so many issues with medical insurance and billing. And if you are out there and you have any collections, if you have any debt that you can't verify or validate, please reach out to me. I would love to have a sit down with you and kind of go over what you got going on. Before I let you go, we always end with a quote of the show, and it goes, it's cheaper to buy 10 years early than pay for it 1 minute too late. Go in grace. Go in
Listen,
grace. Go in peace.
thank
As we're
you.
closing the show, I really appreciate Claudine you coming on. I'm gonna get some water.
Yes, let's get some water because
You know,
we are almost there.
we're
We need
almost
to.
there,
Yes.
but we got to keep
Thank you for
pushing
having
through.
me.
Thank you so much for coming on. And if anybody has any questions, please feel free to reach out.
Yes.
Bye,
Thank
everybody.
you. Bye, everybody.